The San Diego Organizing Project is asking for support for its healthcare organizing work. What makes us unique is that we do not provide direct services, we organize communities. What we mean by that is that we train ordinary people to engage systems and structures that impact them on a daily basis to change so that it better meets their needs. In this case, we're talking about the healthcare system, which is huge and we all know doesn't work very well for people, specifically people that depend on the safety net for their healthcare services. So the problem as we see it is that San Diego County is filled with neighborhood health hotspots. Mostly these are lower income communities of color where there is a high concentration of people that depend on publicly funded programs to get their health care. They suffer from multiple chronic health conditions and they have a limited access to primary care, so they depend on emergency rooms to get that care. The other problem that we have identified is that community or patient engagement is often seen as a one-way transaction. Experts are in one room coming up with innovative solutions, and then they bring those programs to a community and expect that community to embrace them and interact with them in a productive way. We don't think that is sustainable, nor is it real change. We believe that communities must also, it should be a two-way transaction where those closest to the problem have the opportunity to come up with the solutions. We do this through a community engagement model, where the healthcare organizer that you would support spends all of their time in communities, speaking to consumers, residents, helping them understand and identify barriers to receiving good care. They also try to engage those residents in coming up with productive solutions. So we also spend a lot of time learning. What we mean by that is that we are engaging the impacted community with providers in powerful ways. We conduct research meetings with primary care providers, clinics, hospitals, the county, any system or structure that's impacting their health. We bring the experiences of the residents into those systems. What we are doing in these meetings is trying to better understand the system, but also helping the system to understand the needs of the community. After doing that, we believe that's only then can you organize those systems to better serve those people that currently are getting the worst care. And then finally, we move to action. What we believe will look like in this case is that we hope to create 10 patient pilot programs in these hotspot communities that we've identified. These pilot programs will operate almost like schools, almost like charter schools, where we will be creating a smaller, community-driven, community-led project that has the support of the healthcare providers that we believe will actually produce better care at lower cost for those 10 patients. And in doing so, we will create a sense of competition, or almost like holding up a mirror to this larger, less effective system. So what we create, what SDOP builds, is community-driven innovations, local healthcare systems that are truly accountable to the families they serve. We also create regional collaboration between providers and the community, not just providers with other providers, but providers and the community, those that are actually receiving the services. And then finally, we are training local residents to participate in decision-making over healthcare resources, which will make it sustainable, we believe, because when these programs are at risk, the community will fight to keep them.